Nearly 180, that's how many Americans the CDC says died from a traumatic brain injury or TBI each day in 2020. TBIs affect people of all ages, and some of these injuries are more serious than others. Here to talk to us about it is Dr. Chris Stanley. Now, Chris, what are some of the most common ways people can get a TBI?
Most common ways for most people would be football, which is the patients that I see commonly, motor vehicle accidents, work-related accidents, basically anything hard hitting the head.
Okay, well then bicycles, I'm guessing, if you fall off of one, or...
So bicycling is a big one, especially for young kids. I always stress to all kids, even my own, that need to wear a bike helmet all the time. Mine don't always seem to want to agree with their dad, even though he knows what he's talking about, but they don't believe that.
Just so I can understand, is a concussion a form of a TBI? How does that work?
So yeah, so TBI is basically any kind of injury to the brain. Concussion is usually a more of a focal impact of the brain. Think of it like two football players, their helmets hit, that's the point of contact. And actually can cause a bruising of the brain, so to speak. There's a counter-coup mechanism that we learned about in medical school. Basically means that the brain gets hit so hard that it can hit the inside of the skull and cause the bruising. TBI has been kind of used more so for brain injuries in the military, with more like blast injuries or detonations of those kind.
What we would probably see most would be likely a concussion, right? And then what would treatment be for that? So
concussions, we used to, back in my day when I was younger, we would put them in a dark room, no stimulus, not taught to them, let their brain kind of recover. We've studied and learned along the way that that wasn't the best idea. So we want to kind of, I call it like a gentle reset of the brain, and then kind of just introduce their natural stimuli, maybe not quite as much. Patients that I see with concussions, I always ask them how much time do they spend on their cell phones, because the light from the cell phone and they're looking at it, just that causes the intake of the stimulus to cause their brain, which is kind of short-circuited, we'll say. It doesn't work so good. So I always tell them to reduce the time at least in half, 5-minute, 10-minute bursts of on the cell phone. And also another big one is to supplement with omega-3, which is a fish oil, which is actually good for brain health. And studies have shown that it can improve the symptoms of concussion, decrease the duration and frequency of the concussions as well.
Now, a CDC study showed in 2018 more than 44,000 people went to the ER for a brain injury related to bicycling, and 2/3 of those were adults. So what can we do to cut those numbers down?
For bicycles, the simple thing is to wear a bike helmet. They are helpful, and the cost of a bike helmet is way less than the cost of an ER visit.
And then what are some of the long-term health effects of a TBI or concussion?
So I have some patients that have had multiple concussions along the way. So if you have one concussion, then you have an increased risk for getting a second concussion easier, even if the hit isn't as strong as the first one. And then once you have 3, 4, 5 concussions, at that point, we need to reconsider whether this is an activity you need to keep on doing. Few patients that I've had to pull out of sports because their brain has come to the point where the concussions can cause long-term problems, such as decreased cognitive abilities, unable to think properly, and your brain is still developing up until the age of 25 for some people. So that's why I want to make sure that young people's brains can develop like they're supposed to.
Speaking of young people, I mean, kids, like we talked about, they run, they're not looking where they're going. Kids just hit their heads. What should parents look out for? At what point, or is there an impact amount, or are there symptoms that we should look for to be concerned?
So any red flags that would prompt a trip to the ER would be, number one, if they have loss of consciousness at any point. If they're not assessed by a medical professional, they need to be assessed by one. Number two, if they have nausea, vomiting, if they can't see straight, if they have just pain, or if you're just unsure about anything, please take them and get them checked out, and then if it's fine, then they'll send them home. But it's always better to get checked out if you need to.
Dr. Chris Stanley with some great information and safety tips about preventing brain injuries. Thank you so much for being here.
Thank you for having me.